Good afternoon. Thank you for being here. I'm New York State Attorney General Eric Schneiderman. I'm joined by a number of my colleagues in government and from the public health community. Mayor Paul Dyster, City of Niagara Falls, a great public servant and someone who has been a great partner in our efforts to come up with creative solutions to new emerging problems of drug abuse, as is also the case with Superintendent Bryan DalPorto, Niagara Falls Police Department, and I'll explain the Niagara Falls Police Department's involvement in one of our most recent successful law enforcement efforts having to do with synthetic drugs. We also are joined by Dr. Mark Klementowski, who is the Assistant Medical Director at Mount St. Mary's Hospital, Jay Smith, the Regional Director of Rural Metro Corporation, and Sally Yagaric, who is with the parent program. She's the coordinator of the Erie County Council for the Prevention of Alcohol and Substance Abuse. Parent programs are very important, and we're very pleased that she's here. We're also joined by Krista Yerger, the Vice President of Treatment Services at North Point, Niagara County Legislator Owen Steed, and Pastor Harvey Kelly from the Niagara Ministerial Council, as well as some other colleagues who have joined us in the attendance today. And the enthusiasm for this meeting and the commitment of the people who have come forward says a lot about Niagara Falls. This is a community that has been as responsive and as proactive as any in the state on these issues, and I'm pleased to be standing here with you to talk about what is really a huge national problem, but it's a national problem that the federal government's not doing anything about, so it's really up to those of us in state and local government, healthcare and law enforcement to deal with. Synthetic drugs, designer drugs, are poisoning people all across America. These include synthetic marijuana and a host of psychoactive chemicals that are sold as liquids, tinctures, and even candies. We see the damage on our streets, we see it in our emergency rooms, and we are working on this all over the state of New York, but we require the assistance and the creativity and the input of local government to succeed, and our partnership with Niagara Falls is among the most successful. We've just had a meeting coming up, brainstorming about new ideas, how we can protect people from all over New York from this scourge, and we are committed to working together and have worked together successfully on this problem, but there is more work to be done. It is very, very hard for traditional law enforcement to deal with designer drugs. There's a lot of misinformation out there, and the challenge is that if you take products like these they don't have any ingredients. You don't know what is in them. And traditional law enforcement requires that you have a substance, it's been outlawed, you have a kit to test it, and then you can arrest someone. That doesn't work with designer drugs. They turn the stuff out, and the chemicals change all the time. There's a lot of misinformation out there, and because we've been focused on the fact in my office that when it's sold in a store, people, particularly young people, can get the impression that it can't really be harmful. In fact, this can be much more dangerous than street drugs. Synthetic marijuana is much more likely to produce seizures, psychological damage, and other ill effects than actual marijuana. And the variety of the substances poses a lot of challenges to law enforcement. I'm pleased to say that in the Office of the New York State Attorney General, we've come up with a creative way to deal with it that we are now trying to encourage others around the country to adopt. When you come into an emergency room and the healthcare professionals know that you are taking cocaine or heroin, there are protocols to deal with it. When you come in and no one knows what the chemicals, including the consumer of the chemicals, the patient, no one knows what they are, it's much more challenging. And we're dealing with drugs that can cause people to engage in violence, to engage in self-destructive conduct, to have seizures. And this is a problem that has been spiking very, very recently. During a 2-month period this summer, the calls to emergency rooms and to the Poison Control Center related to bad experiences, medical reactions to synthetic marijuana were 10 times the number of calls a year earlier. So this has been promoted and successfully promoted, and there are stores that profit from selling it. There are internet sellers, and we're trying to attack it as creatively as we can. But you can see from the packaging that this is Mr. Happy potpourri. It is something that the packaging indicates that it is designed to appeal to children. This is something that came from a place we've now got an injunction against them in Lackawanna, which is candy. It's kava kava candy. So this is clearly designed to appeal to children. So the ill effects of these drugs are hitting youth and communities all over the state. They're also consumed by adults. But we have, as I said, we've adopted a different approach in the Office of the Attorney General. We realize that trying to it's very, very difficult you can't arrest someone for chemicals that haven't been outlawed, that you can't test for, because these usually don't show up on a traditional drug screen test. But we realize that every one of these products violates the labeling and consumer protection laws, because you are required to tell people what is in a product under the law in New York. So 2 weeks ago, we obtained our 23rd and 24th injunction, and we've been successful in courts all across the state at going into court and saying, getting a temporary restraining order and then an injunction to clear the shelves of all of these products because it doesn't comply with the consumer protection laws. So this creative approach has enabled us to shut down head shops. Some of them just go out of business because they can't stay in business if they can't sell these products. And the last one we just did, Surrealistic Sensations, which is the producers of this candy. It was in Lackawanna, and we obtained the information about them from a tip from the Niagara Falls Police Department. And we worked together to go in undercover and convinced the folks at Surrealistic Sensations that my investigators wanted to open a head shop in Niagara Falls, and they wanted to purchase large quantities of these products. We got the products into the court, and now we've got a temporary restraining order shutting them down. So it's very, very important to understand the depth of the problem. As I say, tenfold increase in emergency room visits and calls to the Poison Control Center from the summer before. Products marketed geared to children, and the fact that the traditional law enforcement approaches to drugs just don't work for this. So we are trying every tool in the toolbox, and as I'm very proud of the fact that we've come up with some tools that no one has ever come up with before. But just in the discussion that we had earlier in the roundtable discussion, there were some other ideas related to public education and how we can make it easier for law enforcement agencies to identify the sellers of these products. This is something that Mayor Dyster and our other colleagues in local government face every day. And in the Attorney General's office, we view our colleagues in law enforcement and in local government as our partners. We get great ideas from them, and it makes I'm very proud of the fact that in this instance we've come up with something, this process of civil injunctions based on the consumer protection laws, that really is proved to be very effective. And I'm hopeful that other people will be using these techniques in other states, will start to use them, and I'm pretty confident that they will. The community here in Niagara Falls has been terrific. You have a police department that's got its ears to the ground in ways that a lot don't. You have a terrific mayoral administration and a great community of advocates and public servants, public health agencies that are committed to doing the job. But this is a fight that we really all need to be in together. So we've brainstormed about some other ideas that we're going to move forward on. I'm very pleased to be here with these with the leaders of the community, and now it gives my great pleasure to introduce someone who has worked with me on a variety of important issues for the state of New York, having zombie properties, abandoned homes, getting microbeads out of the Great Lakes, Mayor Paul Dyster.
Thank you very much. What a nightmarish problem to have to deal with, right? Usually technological change and innovation are positive things, but in this case, they're creating a very difficult and unprecedented challenge for law enforcement, for medical service providers, for first responders. And it's really great as a municipal official to have an Attorney General who is so proactive in looking for tools to try to address these emerging issues in our society. I mean, it would have been very, very easy for you to just throw up your hands and say, well, we don't have laws that prohibit, unknown substances from being put in a bottle, but instead of looking for reasons not to get involved, you've tried to find tools, as on many other issues, including some of those that you've mentioned. You've tried to find tools that your office does have available that allow you to take a proactive approach on an issue, and you've done it again. And I want to congratulate you for getting in front of an issue that in many places is really just coming onto the radar screen. We're happy here that in the city of Niagara Falls, through our philosophy of community policing, we become aware of some of these emerging issues maybe a little sooner than some other cities. But it's always good when we raise our hand and say, hey, who can come help us with this, to have such a strong partner in the Attorney General. So.
Thank you, Your Honor. Appreciate it. And now another great partner in this effort, and someone our office has been working with closely on a variety of issues, Superintendent Bryan DalPorto.
Good afternoon. I'd just like to thank Attorney General Schneiderman for his aggressive and creative approach to a problem which has quickly become an emergency situation in Niagara Falls and really all across the country. In Niagara Falls, we've experienced a significant increase in the amount of calls for police service and investigations involving synthetic drugs. In Niagara Falls, in just 2015, there's been numerous overdoses involving these synthetic drugs. The majority of the victims' ages that the police department has come across has been 16 to 25. In addition to the overdoses, our officers have responded to numerous calls where people high on synthetic drugs that they have purchased at a corner store. In many cases, they become irrational and display violent behavior towards officers or medical personnel. I'm happy to say Attorney General Schneiderman's efforts have resulted in the swift removal of these dangerous synthetic drugs off the streets of Niagara Falls and our community. He has headed off the practice of simply altering formulas of these synthetic drugs to stay ahead of legislative curve and an effort to circumvent law enforcement efforts. Attorney General Schneiderman's approach to attack this issue and the problem to involve everybody in the community, including police, clergy, healthcare providers, is really spot on in our opinion. The message is clear. If your business is to sell illegal drugs in the city of Niagara Falls is no place for your business. I'd like to thank again Attorney General Schneiderman for all his efforts and his great partnership with the Niagara Falls Police Department.
Thank you very much.
Thank you, sir.
Thank you. And now I want to bring up Dr. Mark Klementowski, Assistant Medical Director at Mount St. Mary's. Doctor.
Hi, my name is Mark Klementowski. I am an emergency physician with Team Health at Mount St. Mary's Hospital. I am the Assistant Medical Director at Mount St. Mary's in the Emergency Department. Through working in the ED, I have seen many people who have taken these drugs, and I've seen the effects that these drugs have on these people. The so-called bath salts, they elevate the neurotransmitters in the brain, and they can cause agitation, paranoia, hallucinations. They can increase the heart rate and blood pressure. They cause many more serious life-threatening injuries, which people can become very aggressive, express very violent behavior. They can actually have seizures and kidney failure, and they can even rarely cause death. Spicer K2, which is the synthetic marijuana, also has very unpredictable effects that these people are taking. They can increase anxiety, paranoia,
K2.
Yep, confusion, hallucinations, and they can also cause heart attacks. Many times when people finally come off of this high or whatever they're feeling, they have no recall of what they've done or how they were behaving. And it's amazing that, when you sit there and talk to them, they deny that they've done anything like that. I wouldn't have done that. No, they did. In my experience, these drugs have a new heightened level of agitation and worsening violence than we've ever seen in the emergency department. It's put not only the patient's health at risk, but also the medics, the nurses, the physician's health and our lives at risk in attempting to safely care for these people. One instance last year that we had this gentleman come in, and we had to have about 6 or 7 grown adults, men, to try to hold this person down. And that includes anywhere from nurses and the medics, and even the police were there to help just to hold this person down so that we could try to eventually give this person medicine to try to prevent any injury to themselves or others. And that day, it was nice because we had that many people in the emergency department to help us out. In addition, I've seen an increase in the number of people who were under the influence of drugs when they were driving and were involved in an accident. You know, people are involved in accidents, they come to the emergency department. And it would be a tragedy if one of these drug drivers actually killed themselves or someone else. So I would agree with Attorney General Schneiderman that these drugs need to be taken out of our streets for the public safety as well as for those taking care of the public. Thank you.
Thank you very much, Doc. Thank you. And now we're going to hear from Jay Smith, the Regional Director of Rural Metro Corporation.
Thank you, Mr. Schneiderman. I'm Jay Smith. I'm from Rural Metro Medical Services. I'm the regional director, and we're the ambulance company serving the area. I talked to my medical director about this for today's purposes, and opiates continue to be the most common life-threatening overdose seen in Western New York, but the increased prevalence of K2, as the doctor just mentioned, is extremely troubling. As far as from the ambulance provider's point of view, based on the overall statistics, and this is for our region, a 2-county region, our call volumes have been impacted by synthetic drugs. When our team arrives on scene, the crews don't always know what the overdose is going to be or what the condition is, and unfortunately they have to just treat what they come upon and see. But when you look at our information, you can see that there's definitely been an increase. Also, when responding to an unconscious persons due to possible overdose, we've seen a 23% increase in this type of call from 2014 to 2015. Another way for us to look at this is, in addition, when you look at the number of times our crews have administered nasal Narcan or just Narcan from 2014 to 2015, we've seen over a 67% increase. This is obviously significant, and within this increase is the use of synthetic drugs. The dangers of synthetic drugs have been mentioned, and as you can imagine, to an ambulance crew arriving, the medics and the EMTs, this is and other first responders, a very problematic situation. We usually do not know the type of the overdose or the overall negative impact it can have to the person's cardiovascular and central nervous system. And there definitely seems to be a culture change where people have this belief that they'll be okay, that the first responders and medical community will take care of them. We're seeing an issue in that rising as well. So once again, thank you very much for having us here as part of it today, and I appreciate the work of the Attorney General.
Thank you. Thank you. And wrapping up, we're going to have the Parent Program Coordinator and Public Educator, Sally Yagaric. Sally?
Thank you. I am Sally Yagaric from the Erie County Council for the Prevention of Alcohol and Substance Abuse. And I want to thank the Attorney General and his staff for the efforts that they put forth to get this life-threatening drug off of our streets. These synthetics, aside from being very addictive and dangerous, they're being misrepresented to the consumers, and the young people that are purchasing them have no idea what it is they're purchasing. We need to do a better job, as the Attorney General has stated, in letting people know what they truly are. And the public education will go a long way in helping with that. Our agency actively, through our outreach, tries to educate people, and we will continue to do that on all the drugs that are there. But in our community, we've seen firsthand the increase in the emergency room cases, the increase in crime, in violence, and the increase in harm to self and others. We've seen it in our communities, and something needs to be done about it. The prevention field is doing all it can to educate, and we would like the opportunity to work in partnership with anyone that's out there that would like to join us. Again, we would like to thank the Attorney General and his staff. My thought is today that raising the awareness like this will be the pebble that'll start the ripple, and we will be able to start talking to our kids through our community, our places of worship, and our schools. Open up the conversation and start educating. Thank you very much.
Thank you.
Thank you.
Thank you. Thank you. And as Sally mentioned, my Buffalo Regional Office and the head of the office, Mike Russo, is here with us today, as is Marty Mack, who's my Executive Deputy Attorney General for all of our regional offices. Please, if you have information about a store that's selling these products, bring it to us, report it to the local police, and we can work together with them on trying to shut them down. This does require us to have undercover investigations go in, because you have to establish that they're selling, what they're doing, and how they're talking about these products when they're sold. But this is dangerous, dangerous stuff, and it's being sold every day. And the fact that it is sold in stores that are legitimate licensed businesses sends a message that it's okay. And a lot of people figure, well, if someone's selling it in a back alley, maybe it's dangerous, but if I can get a product in the store and it's got the nice packaging like this, then it should probably be all right. It's not true. And the group here today this is the coalition we need all over the state of New York to address this problem. We need law enforcement, we need local government, we need the public health community, the medical community, and we need the faith-based community, because that's where a lot of the best information comes from and goes to. That's where a lot of education is done, and that's where a lot of information that helps law enforcement is developed. So, ladies and gentlemen, Niagara Falls is at the forefront of this effort to develop coalitions like this. That's why we're having this meeting here today. And again, the help we got from the Niagara Falls Police Department to help us shut down this major internet supplier of dangerous drugs like this kava candy. This is a place in Lackawanna that we have now stopped them from selling these products. Wouldn't have happened without the help of the good people here. So with that, I thank you all. We're not going to rest until we deal with this problem. It's with us now, but we've dealt with big problems before. And with the kind of enthusiasm that we're seeing here today, I'm confident that we will be able to end this particular scourge of drugs and keep all New Yorkers, particularly our children, safe.